In the quiet moments of daily life, an invisible threat looms large for many seniors: stroke. Often striking with little fanfare, its early warning signs are easily, and tragically, mistaken for the innocuous quirks of aging, a touch of fatigue, or simply feeling a bit off. This deception is dangerous, creating a false sense of security while a critical window for intervention rapidly closes. Each missed signal isn't just an oversight, it's a forfeited chance to preserve life, independence, and the very essence of who we are. We must recognize these subtle alarms, for they whisper of a brain under siege. The medical community often reminds us, time is brain. This isn't just a catchy phrase, it's a stark reality. When a stroke occurs, blood flow to part of the brain is interrupted, starving cells of oxygen and nutrients. With every passing minute, millions of brain cells die, leading to potentially irreversible damage. What might seem like momentary dizziness or a fleeting numbness could be the opening salvo of a profound neurological event. Delay isn't just inconvenient, it's a direct pathway to permanent disability, loss of cherished independence, or even death. Understanding this urgency is paramount for seniors. Why are these critical warning signs so often overlooked? The answer lies in their deceptive nature. A minor stumble might be attributed to just getting old. Slurred words might be dismissed as tiredness or stress. A sudden headache? Perhaps a migraine. Seniors, in particular, are prone to normalizing these changes, reluctant to bother anyone, or simply unaware of the grave implications. Yet, these seemingly benign symptoms are often anything but. They are urgent messages from a brain in distress, signals that must be intercepted and acted upon with the utmost speed and seriousness to avert catastrophe. Our first critical warning sign focuses on the face. Has there been a sudden, noticeable droop or numbness on one side of your face? Perhaps when smiling, one side seems to lag or doesn't move at all? This isn't just a peculiar sensation, it's a clear indication that neurological function is compromised. This asymmetry, this sudden loss of control over facial muscles, is a hallmark sign of a stroke actively disrupting the brain's signals. Every moment you observe this without seeking help, precious brain tissue is being lost, and the potential for full recovery diminishes rapidly. When the face droops, it signifies that the part of the brain controlling these delicate muscles is being deprived of oxygen. This could be due to a blocked artery or a bleeding vessel, interrupting the vital communication pathways. It's not merely a cosmetic issue, it's a direct reflection of a serious internal event. Ignoring this sign means allowing the damage to spread, increasing the likelihood of permanent facial paralysis, difficulty eating, or speaking. This subtle visual cue demands immediate, unambiguous action, as it reveals the immediate crisis unfolding within the skull. Consider this: can you raise both arms over your head and keep them there for a few seconds? If one arm drifts downward or feels suddenly weak or numb, unresponsive to your will, this is an alarming symptom. This isn't just muscle fatigue, it's a neurological disconnect. The brain's signals, usually so precise, are now garbled, struggling to reach the limb. Often, individuals experiencing this might drop objects without warning, or find simple tasks like dressing suddenly impossible. This sudden, inexplicable weakness or numbness on one side of the body is a potent indicator of a stroke unfolding, demanding urgent assessment. The brain's motor cortex, responsible for voluntary movement, is intricately mapped. When a stroke impacts this region, the communication lines to specific body parts, often an arm or leg on one side, are severed. This isn't temporary stiffness, it's a profound impairment indicating brain cell death. Left unaddressed, this can lead to permanent paralysis, severely limiting mobility and independence. Imagine losing the ability to grasp, to walk steadily, to care for oneself. The sudden onset of arm weakness is not a sign to wait and see, it's an urgent plea from the brain for immediate life-saving intervention. Can you speak clearly and coherently right now? A sudden change in speech, manifesting as slurring, garbled words, or difficulty finding the right words, is an alarming sign. This isn't just a slip of the tongue or an inability to articulate due to fatigue. It's a sign that the language centers of the brain, critical for communication, are under attack. Friends or family might notice at first, asking if you've had a drink, when in reality, something far more serious is unfolding internally. The inability to communicate effectively is a direct threat to immediate safety and future quality of life. Our ability to communicate is fundamental to our independence and connection with the world. When a stroke damages the areas of the brain responsible for speech and language, the consequences are profound. This isn't just about mispronouncing words, it can mean total inability to express thoughts or understand others. This condition, known as aphasia, can be incredibly isolating and debilitating. To preserve one's voice, one's connection, and one's autonomy, recognizing sudden speech changes as an urgent medical crisis is absolutely non-negotiable. Every moment of delayed action compounds the risk of irreversible loss. Have you experienced a sudden blurring of vision, or even complete loss of sight, in one or both eyes? This isn't just needing new glasses. This abrupt onset of visual disturbance, often described as a curtain coming down or a sudden blind spot, is a critical red flag. The brain's visual processing centers or the pathways leading to them may be under acute attack. This alarming symptom demands immediate medical attention, as it signals a potentially widespread disruption of brain function, not just an isolated eye problem. Delay could mean permanent blindness or severe visual impairment. Vision is our primary sense for navigating the world, for safety, and for enjoying life. A stroke affecting the visual pathways or the brain's visual cortex can rob an individual of this vital sense. This impairment can range from partial loss of peripheral vision to complete blindness, turning familiar environments into dangerous obstacles. Imagine losing the ability to recognize faces, read, or even see the path ahead. Such a profound change, if sudden, is a desperate signal from the brain. Acting quickly can mean the difference between seeing your loved ones tomorrow and facing a world of permanent darkness. While headaches are common, a thunderclap headache is not. This is a sudden, explosive headache, often described as the worst headache of your life, appearing out of nowhere. It's unlike any ordinary tension or migraine headache, its intensity peaks within seconds or minutes. This extreme pain is a critical indicator of a potentially catastrophic event within the brain, such as a hemorrhage or an aneurysm rupture. It's a direct scream from the brain that something has gone terribly wrong. Never dismiss such an extreme, sudden headache as just another ache. It's an emergency that demands immediate attention. A thunderclap headache often signals a hemorrhagic stroke, where a blood vessel in the brain has ruptured, causing bleeding into the surrounding tissue. This bleeding rapidly increases pressure within the skull, leading to intense pain and potentially severe brain damage. Unlike an ischemic stroke caused by a clot, hemorrhagic strokes can be even more immediately life-threatening. The sudden, debilitating nature of this symptom should trigger an immediate call for emergency medical help. This isn't a symptom you can sleep off, it's a profound alert that your brain is facing a severe internal crisis. Are you suddenly struggling to walk, feeling dizzy, or losing your balance without any clear reason? This isn't just clumsiness or a momentary lightheadedness often attributed to dehydration. A sudden, unexplained loss of balance, coordination, or persistent dizziness can be a critical sign that the cerebellum, the brain's control center for movement and balance, is being affected by a stroke. This can manifest as an inability to walk in a straight line, staggering, or a sudden, unexplained fall. Ignoring this jeopardizes not only immediate safety but also long-term mobility and independence. Balance and coordination are fundamental to independent living, allowing us to move safely and confidently. A stroke impacting the cerebellum or brainstem can severely disrupt these functions, leading to chronic instability, frequent falls, and the eventual loss of autonomous movement. The inability to maintain balance can lead to a cascade of further injuries and greatly diminish quality of life. When these vital abilities are suddenly compromised, it signals an immediate threat to the brain's core functions. Recognizing this as an emergency, rather than a mere bad day, can safeguard future mobility. Our final critical warning sign is sudden confusion or difficulty understanding. Has someone you know abruptly become disoriented, unable to follow simple commands, or seems to be in a daze? This isn't merely an off day or minor forgetfulness. A sudden onset of confusion, disorientation, or trouble comprehending speech points to a significant neurological event. The brain's higher cognitive functions are directly affected, signaling a potential stroke. This can be particularly frightening for both the individual and their loved ones, as it impacts personality and the ability to interact with the world. Our cognitive abilities define much of who we are, our memories, our reasoning, our personality. When a stroke assaults these areas, the very identity of a person is at risk. A sudden inability to process information, recognize loved ones, or engage in meaningful conversation is a devastating consequence. This is not normal aging, it's a severe blow to the brain's command center. The urgency to act when confusion strikes cannot be overstated, as every moment lost could lead to permanent cognitive impairment, reshaping a life forever. Protecting these functions is protecting the self. Recognizing these 7 subtle, yet critical, warning signs is the first, most vital step. The next is immediate action. Do not wait to see if symptoms improve, do not attempt to sleep it off. If you or someone you know experiences any of these signs, even if they are fleeting, call emergency services immediately. Time is not a luxury you possess in the face of a stroke. Emphasize the FAST acronym: face drooping, arm weakness, speech difficulty, time to call 911. This simple framework can empower anyone to act decisively when every second truly counts. Modern medicine offers powerful interventions for stroke, but their effectiveness is acutely time-dependent. Clot-busting medications, like TPA, can reverse stroke symptoms entirely if administered within a few critical hours. Similarly, mechanical thrombectomy, a procedure to physically remove large clots, has an even tighter window. Missing these narrow therapeutic opportunities means irreversible damage. Understanding that specialized treatments exist, but are contingent on immediate medical access, underscores the overwhelming urgency. Rapid diagnosis and treatment can mean the difference between significant recovery and devastating lifelong consequences. While the prospect of stroke can be frightening, there is immense hope when early warning signs are recognized and acted upon swiftly. Timely medical intervention can significantly reduce the extent of brain damage, allowing for greater recovery and a return to a fulfilling life. Survivors who received immediate care often experience a more complete recovery of function, regaining speech, mobility, and cognitive abilities. This isn't just about survival, it's about preserving quality of life, maintaining independence, and continuing to engage with the world on your own terms. Your prompt action can secure your future. The power to mitigate the devastating impact of stroke lies in awareness and preparedness. Educate yourself, your loved ones, and your community about these 7 critical early warning signs. Talk about them. Memorize them. Discuss what to do if they appear. Have an emergency plan. By understanding that seemingly minor, sudden changes can be major alerts, we empower ourselves and those we care about to act swiftly and decisively. Remember, these aren't just symptoms, they are urgent calls for help from a brain under attack. Your vigilance could save a life, preserve independence, and prevent a tragedy.